Welcome back to the Now Morning Show. Now, the Anthony N. Sabga Awards for Caribbean Excellence will be awarding 3 amazing and exceptional Caribbean nationals: an author from Antigua, a public health doctor from Trinidad, and a rice researcher from Guyana. And that event is happening this Saturday, June 3rd, in a gala ceremony at the Hilton Trinidad Hotel. And so joining us this morning are the Director of Women's Health at the Ministry of Health, Dr. Adish Surju Singh, the Laureate for Public and Civic Contributions and Communications Consultant for the awards, Mr. Robert Clark. Gentlemen, good morning.
Good morning.
Good morning to you.
Thank you so much for joining us.
Thank you.
Off the bat, congratulations, Dr. Surju Singh.
Thanks very much.
I think it's a really, really amazing honor.
Thank you very much.
I'm coming first to you, Mr. Clark, the Anthony N. Sabga Awards. Tell us about the awards.
So the awards were established in 2005. We had our first laureates in 2006, and since then we have awarded 57 Caribbean nationals, including Dr. Surju Singh in that number. And they come from the fields of arts and letters, entrepreneurship, public and civic contributions, and science and technology. So Dr. Surju Singh is one of 3. We have 2 others. One will be joining us from Antigua and one from Guyana this year. So the Anthony N. Sabga Awards is actually the philanthropic arm of the Ansa McCall Group. Yes, so it's how we give back to the community, to Caribbean society.
Yeah. Now, I know that we are familiar with Dr. Surju Singh, but tell us about the other 2 laureates.
The other 2 laureates, Joanne C. Hillhouse is an author from Antigua, and she not only has she published across a great span, she has everything from children's books to young adult to adults' contemporary novels, but she also holds much of the literary culture of Antigua on her shoulders, because she does workshops, she does a writing challenge, and she really is an interesting person who works as a journalist and writes. And our other laureate, Dr. Mahendra Prasad, who unfortunately was supposed to join us by telephone this morning, and I'm sorry that he couldn't. He's on his way to a plant genetics workshop. He is a plant scientist, and he is the chief scientist at the Guyana Rice Development Board. And his accomplishment, his major accomplishment, is increasing Guyana's rice yields by up to 50%, which is significant for the farmers, because farmers who were once unprofitable, based on the varieties that Dr. Prasad and his team have produced, are now able to make reasonable livings. And of course, then we have Dr. Surju Singh, whose accomplishments in women's health and maternal mortality reduction are significant.
Yeah, I know we were introduced to Dr. Surju Singh and his team, of course, at the height of the pandemic, when we were talking about those pregnant women who, you know, may have contracted the virus and the sort of, the contact it can have to the fetus. But how did you intend to reduce, or how did you reduce, Doc, the mortality rate, the maternal mortality rate in TNT, and by how much?
Right, okay, so again, thanks again. And of course, we did meet during those, I would say, those dark days.
Yeah, those dark days,
pandemic, and those numerous press conferences and so on. So thankfully and hopefully they're behind us.
Fingers crossed.
Actually, some of those issues contributed to maternal mortality and poor outcomes for mothers and children as well. So that was actually a major event that occurred that contributed to some of that. So for years, Trinidad and Tobago, of course, we have a lot of well-trained medical staff. We put a lot of resources into the healthcare systems, but we weren't making a dent in maternal mortality and improving the outcomes that we should have seen. We should have been on par with those industrialized countries. Something wasn't going quite right. So we had numerous committees over the years, appointed on Prime Minister's committees. I worked with a lot of teams over the years, and we made documents. We just didn't get it enacted. And that's why I came in. And of course, I had a lot of support from the Ministry of Health executive, from the Minister of Health. And basically, we put things in place so we were able to improve our outcomes for mothers. So no longer would we had some alarming statistics. Prior to 2015, at least probably 1 mother was unfortunately dying per month, 10 to 12 per year. And now we are still sad. We are at about 2 women per year. But that has met the standards for the Sustainable Development Goals of the year 2030. We've done that actually since 2018. We've been able to achieve those goals, which means on any given year, 6 to 8 mothers are probably alive who may not have been alive if we had continued the same way. And for babies, it's even better. 80 to 100 babies a year are probably alive who may not have been alive in the neonatal period, the newborn period. to survive and continue to thrive. So we continue to keep a close eye. Of course, we don't want to go backwards. We have to keep improving and keep improving on those standards.
Doc, what can you say can be attributed to that decrease in mortality, but increase in the number of babies that we're keeping alive over a longer period of time?
Oh, yeah, well, a lot of factors. Of course, number one is teamwork, coordination of the teamwork. You can't do it without that healthcare system. I just represent at the front end right now, but it's a lot of work in the background. We give you the resources. We have trained personnel. We have top of the line people. Of course, we always celebrate when we go abroad and we make it big abroad. But right here, we have homegrown specialists, many of them in the background working hard day to day. Dr. Marlon Timothy, I must say, special mention. He has marshaled the troops in the neonatal units throughout Trinidad and Tobago. And for newborn mortality, we were probably estimated near 2015 as 12 per 1,000 live births that's dying. It's down to 6 per 1,000. That's a phenomenal achievement, and we continue to push those boundaries. Every day you'll hear about things happening in the neonatal unit as well as, of course, in the maternity units.
Dr. Sujusing, I have to ask you, you mentioned the host of specialists that we have, but some of them have moved on to private practice.
Yes.
You, on the other hand, have managed to stay in public service, I believe, for like over 25 years.
Yes.
What is the reason for staying in public service? Because I can't ignore the fact that you would hear the complaints from mothers who say they may have gone to a certain hospital, they may not have gotten the treatment that they wanted. Yeah. So why is it that you stay year after year in public health?
Oh, that's a difficult question. Of course, always people ask me that. My own colleagues ask me, what are you doing, you know? I really want to leave a legacy behind. I always say I have children. I know where I came from. I came from very humble beginnings. I have a sad story behind all of this. My mom's mom, my grandmother, actually passed away in childbirth after having her baby at the Sabga Grande Hospital, actually. And many years ago, never met her, of course. And that spurred something in me, and I came into obstetrics and gynecology at some point. And I say I had to do something better to leave something behind for my children. I would look at them day to day, something for the population. And you can only do it from inside. You can't go outside and complain. And you have to hear the complaints and leave things better than you found it.
Yeah. I like that you mentioned the Sabga Grande Hospital, because I can understand now your passion for that particular hospital as well.
Yes.
I mean, how has it grown over the years? I mean, talk about some of the achievements there.
Yes, so I would have actually taken over the helm, along with, of course, we had a lot of other staff there as well, since 2009 to 2017, that period of time. But I inherited there was a lot of good work done by one of my good colleagues, Dr. Dale Hasrana. And what I would have done is concentrate on improving maternity and newborn services, but also upgrade. We had a lot of improvements in staffing, infrastructure, getting the hospital accredited for training. So I was able to get a lot of locals to take charge of the hospital, invested in what I call them young doctors, but they are now the senior doctors there. They are the specialists there. And they are, have invested in that population, and they will keep that place going. I've also helped plan the new hospital that's building as well. So there's a lot of good things that are going to happen in Sabga Grande.
I mean, Mr. Clark, I can definitely see why Dr. Sujusing is one of your laureates, but speak more to the sort of candidates or the sort of people who get these awards. I mean, what are some of the things that you look for, that criteria that you look for to judge them against this?
Well, the screening is quite rigorous because first you have to be nominated, some self-nominate, some will be nominated by...
So you can self-nominate?
You can,
okay.
Yes, you certainly can. And then you are screened by your country nominating committee. We have 5 of those: Guyana, Barbados, Jamaica, Trinidad and Tobago, and the OECS. Then you go up to the Eminent Persons Panel, which is chaired by Professor Compton Bourne, formerly of UE, and they go through another screening process. So it's a rigorous process to be screened as a candidate. And our candidates really are between the ages of 35 and 55. Most of them have a significant body of work, like Dr. Sujusing, behind them. And at the age of 55 or under, we expect that you will accomplish more. So we always look on at our laureates and see what you have done since receiving your award. So these really are exceptional people. And I'm very fortunate, I was going to say about Sabga Grande Hospital. We produce videos with all our laureates to tell you a little bit about their lives and their work and what makes them exceptional. And we went up to Sabga Grande, and I must say, despite having left there, and I don't know if Dr. Sergio Singh felt the same way, but the staff morale came across as very good, and that, I guess, would be in part to his legacy. He's a modest person, and
Very.
and he has accomplished a lot. He also gives to the people of his community, former community. He grew up in Dinsley, Tacarigua, and he kind of is always available. As a doctor, is one of the hazards of the job, right?
Yes, yeah.
But he's always available to people to help and assist in any way that he can.
Yes. Mr. Clark, and this award ceremony, is it a year thing? And how many people are awarded each year?
It is an annual thing, and since 2006 it was biannual to begin with, and now this year we have 3 laureates because we have not awarded an entrepreneurship candidate laureate this year, and that shows you the rigor of the screening process.
Yes,
we decided that there was nobody this year who was worthy, but we have in the past. Last year we awarded 5, but we have our 4 categories, and generally we will award in all 4 categories. Yeah.
Dr. Sergio Singh, I'm coming back to you. Mr. Clark, and I believe all the previous laureates would have mentioned how prestigious it is to get this sort of award. How do you feel?
It's a bit overwhelming. I was actually nominated by some colleagues very quietly, without me knowing, but of course at some point they would have
Contacted
asked
you
me
and,
some more information and so on. So it was really an honor. One doesn't look for honors. I always say success should be a byproduct of the work you do. It should come naturally, and I think that embodies all of the past and present laureates as well, from when you look at their careers. But it does validate the work you do. It validates the teams behind me. They're so proud of what, I am representing them, of course, but of all the work that we do is finally acknowledged, and it's more so in the public healthcare system. That's something that's never been done before at this level.
I'm coming back to you, Mr. Clark. Can you speak to some of the previous laureates as well who would have awarded these Sabga awards too?
Yes, well, they span the gamut clearly. We have people like filmmaker Robert Yao Ramasa. We have Kim Johnson, who has done a lot on the history of steel pan. We have people from NGOs. We have a priest out of Jamaica who has worked with street children and has done very significant work with us in the area of public and civic contributions as well. We have people like Professor Christine Carrington.
I remember her from last year. Is it last year?
Yes,
Yeah,
molecular virologist.
Yes.
She was doing a lot of work on COVID.
Yes, another member of the COVID team, yes.
Yes, and later went on after our Anthony and Sabga Award to get a national award, the Shakonia Gold. So we feel good about our College of Laureates. We're very proud of the work that they have done and they continue to do.
Nice. Well, gentlemen, let me thank you so much for joining us this morning. Again, Dr. Sergio Singh, well represented, and I think well deserved as well. Congratulations on your award, and I know that you're going to stand out really, really among everybody else when the award ceremony is this Saturday, at Hilton. So congratulations again.
Thank you.
Thank you so much for having us.
And that was Dr. Sergio Singh, and of course, Mr. Clark, the communications consultant at the Anthony N. Sabga Awards, just sharing a bit about the award ceremony, and of course, congratulating our laureates who are going to be receiving their awards this Saturday at the Hilton Trinidad Hotel. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.